Delusional disorder. So we're going to talk about case one. This is a case regarding Mr. Dashi. He's a 23-year-old Japanese student. He started having delusions about 3 months ago after his trip to Japan. Actually, during his trip to Japan, he actually used cannabis for the first time and started hearing voices and delusions while he was under the influence. After his Japan trip ended, he never used cannabis again. The only time he had the hallucinations, they were experienced while he was under the influence of cannabis. So after the cannabis kind of like worked its way out of his system and he was not under the influence anymore, the hallucinations resolved, but the delusions did not. What happened was he came back to America. He started believing there was listening devices and thought controlling machines planted in his apartment. He actually believed that two strangers outside of his apartment were responsible for planting them. He thought that Fox News was behind the planting of the devices and that they were placing conservative thoughts in his head. He also believed he had superior intelligence and that he was going to become prime minister. He believed that people were plotting against him. He became very withdrawn. He dropped out of school. He was able to continue maintaining his hygiene and grooming, being well groomed, and he was eating. But he did describe being afraid, and he didn't portray any effective emotions of being afraid. So now we're going to look at the rest of his symptoms. He had the belief in the listening devices, so he had several paranoid or where he thought people were persecuting him. So he had delusions of being persecuted, with the listening devices, people watching him, thoughts being placed in his head, and Fox News being behind all the planning devices. All of those help to further say, yes, this is delusion. When he started having beliefs of superior intelligence and being prime minister, that's a grandioso delusion. When people are plotting against him, once again, paranoia. So he has two different types of delusions, but no other types of any psychosis besides. When he described himself as being afraid, but he didn't portray any effective emotions of being afraid, that's just a fact of a delusion. He's not really having a real mood or affective disorder or signs of that. There's no true equality between the affective symptoms and the delusion symptoms. And because there's no equality, basically 50% of it's affective and 50% of it delusions, since there's not that equality there, it rules out any of the depression with psychotic features and mania with psychotic features or anything like that. It just rules all of those. Anything to do with those kind of things, it rules them all out. So now we're going to look at the rest of his symptoms. He became withdrawn and dropped out of school. When you look at that on the surface, you can say, okay, that's a sign of depression. But I want you to also open up your mind to basically saying, is it a sign of depression, or can this be a sign of how severe the diagnosis of the delusional diagnosis is? He continued to eat and maintain hygiene, and he continued to groom well. And that statement lets us know the severity. So becoming withdrawn and dropping out of school, that's actually part of how severe it is. That's not a symptom of depression, okay? So we're looking at, so we basically have really decided this is delusional. He meets the criteria because he's had this for 3 months. It's longer than 1 month, so he meets the time frame. He has multiple types of delusions, and we basically ruled out substance disorders. We ruled out the absence of symptoms, such as with the affective disorder. We know he has 2 types of delusions, and so that meets the classification for a mixed delusion. So he has the delusional order of mixed type. Okay, males are basically, just FYI, males are at higher risk for having those paranoid type delusions. After them, they do very well. Males do very well with being treated with clonazepam or any kind of long-acting psychotic. Typically, those are with injections. They can be once a week, every other week, or once a month type injections. And when you are going, if you're going to be a provider for these patients, it's very important when you're meeting that patient, you need to establish that trust. And that's actually more important at the beginning of that relationship than starting to treat the patient. Because if you just go in and you just want to find out what they have and start treating them, and you think that you can build that relationship after that, nah, they got to have that trust first. Otherwise, they ain't going to take your medicine. They're going to think that you're trying to poison them. It's also really important to look at CBT, adding CBT, because these patients actually have a really good prognosis. They will actually do much better than any schizophrenic patient. And so CBT helps them to be able to control things. It gives them the skills necessary to control those really bad days or whatever. You're not going to be able to medicate for every day. So CBT treatment, you've got to teach the family, anybody who's going to be participating in the patient's treatment, teach them, and it really helps the patient be able to overcome all those kind of things, that with the medication. Another thing to FYI in regards to this study, Asians, period. There's two important things to remember. Asians will respond faster and be more sensitive to the side effects due to their genetics. So when you're giving this medication, start low, go slow with the medication, because they're going to respond faster. They're going to have the TDs, the dyskinesia, faster than some of the other races. And then also Asian patients, because they also are slimmer, they have less of a fat content and stuff on them. When you start weaning the patient off of this, they don't have enough. The fat cells generally store medication in it, so that when patients are weaned off of it, that medication is released into the blood system. Well, Asians without those extra fat cells, they tend to rebound faster than other patients do. So it's really important that you can end up getting withdrawal effects much quicker with Asians than with the other races. Okay. Any questions?